Hey everybody, it's Mike from the Mike Wagner Show, powered by Sonic Web Studios, brought to you by our official sponsor, the Mike Wagner Show, international warring author Mia Molson's Missing, available on Amazon in paperback and ebook, and coming soon, Missing 2 by Mia Molson's double the suspense, double the fun. Check it out on Amazon. Also brought to you by Sweet Psalmist by Serena Wagner, based on the life of King David, including 30 exquisite paintings, King David Psalms. Check out the Sweet Psalmist by Serena Wagner, based on the life of King David, on Amazon. Keyword Sweet Psalmist Serena Wagner. We're here with the amazing president of a company that's a leading medication at home pharmacy service and co-founder and principal of this group and pharmacy management company, supporting a community of pharmacies and health systems, 15 years experience at the helm, and talks about how a Trump win will affect healthcare, AI in healthcare, revolution or risk, and also the state of healthcare as well, insurance and more, and how this lay is going to make a big impact on it. Live, ladies and gentlemen, plus dudes in beautiful Southwest Florida, the amazing president of Centennial Pharmacy Services, and also the principal of Centennial Pharmacy Group, and basically talks about Trump win affecting healthcare and how it will do so. So this is really compelling. Listen up. We got the multi-ton Lindsay, Dymowski, Constantino. Lindsay, good morning, good afternoon, good evening. Thanks for joining us today.
Thank you so much for having me. I'm excited to be here.
Well, it's great to have you on board, Lindsay. And this is a pivotal moment in history as we speak to start off 2025. You're president of Centennial Pharmacy Services, a leading medication home pharmacy, and you're also co-founder and principal of the Centennial Group, a pharmacy management company supporting community pharmacies and healthcare systems. You've had 15 years experience at the helm. You'll be talking about how a Trump win will affect healthcare, price transparency, reduce regulatory burdens, and market-driven efficiency, and also AI in healthcare. And how's that going to affect it? We're going to find out. Before getting on it, Lindsay, tell us how you first got started.
Well, I was fortunate enough to actually grow up in pharmacy. My parents owned pharmacies, and so when I was little, some kids had to make the bed. My job was to dust off the drug bays at the pharmacy.
Oh,
So,
okay.
yeah.
Nice.
Exactly. I grew up in the industry and I really started to love it when I was in high school. And I would spend a lot of time working alongside my dad, who's a pharmacist. And I really started to learn the ins and outs of not only operating a business, but also seeing how pharmacies or pharmacists rather can truly impact patient care. So I decided to take on pharmacy as my career. I actually started a segment of my family's business, which focused solely on medication management solutions for high risk patients who were living in the community. So, what I wanted to do was really hone in on the different types of support that my parents were providing through their pharmacy in the community and be able to go to provider offices and accountable care organizations and even different types of insurance companies and see if we could make more of a widespread impact on patients who needed it the most. So we ended up getting a couple of different partnerships with providers and payers, and we were able to truly make really great impacts that were all pharmacy based with those patients' health, and the business ended up taking off. So we have Centennial Pharmacy Services that's headquartered in Philadelphia. We support the Tri-County area there. And then we also have the Centennial Group that you just talked about. We support different types of health ecosystems to be able to build in medication management programs. And then I also have what we call the Long-Term Care at Home Pharmacy Network and the Long-Term Care at Home Pharmacy Quality Commission, which are the two businesses that actually support the industry for long-term care at home pharmacy, which is that medication management at home, long-term care level of support for those high-risk patients.
Now, with your mom and dad being pharmacists, was this like an independent pharmacy, or was this tied to a hospital, or was this tied into a store or anything like that back in the day?
So they were little independent pharmacies, the corner stores that you would see where, a lot of times historically it would be like the soda pop shops, right? You go get your medicine, your root beer floats, and that's where I grew up. So we had community pharmacies all across the city of Philadelphia and even into South Jersey. And it was a really great exposure into healthcare. And it was interesting for me to always get an understanding of what was really going on and what was truly impacting the patients. Because I think what a lot of people don't realize is that people will go to the pharmacy counter and talk to the pharmacist as if they're a friend, which they can be, right? And
Right.
there's
I
a big
remember back in the day, even he'll buy you root beer float. And if you brought
right.
your brother's sister or your son or daughter with you, it's like you get a little treat, or you say, here's a quarter, go buy a toy or something, like a little car, dollar,
Exactly.
or a piece of gum or something. So
Yeah, yeah, it's like that. So, the pharmacist is kind of this person in healthcare who is really an accessible healthcare provider, but also the public doesn't necessarily always see them as a healthcare provider, and that can be to their detriment at times. But it can also help lead to greater conversations and better understanding about the holistic view of a patient, because we find also that patients are a little more honest with their pharmacists. Like they're not afraid to tell their pharmacist that they've missed some medicine, but they don't want to tell their doctor that they missed some medicine. So,
right, yeah. And of course it's easier, better access, everything like that. They'll say, okay, here's a little more. Don't do it again, please. Like that. So
yeah, yeah, exactly, exactly. But then the pharmacist can have that conversation with the doctor and say, hey, Mrs. Smith told me she's having trouble remembering her meds at night. Why don't we try to solve this? And so that's really where it started. Is I saw my dad having those types of conversations, and I said, there can be real impacts made here. And thankfully, we've truly been able to make impacts to thousands of patients now, and I'm so proud of it.
And you've done an amazing job as well too. And of course, you guys had support a number of doctors, hospitals, and other pharmacies throughout the time. And at what point do you think it got to where it's like they eliminate all that and it got more into the corporate where it's like it had to be like with the hospitals or the networks or anything like that?
Yeah, well, it's interesting because I think there's a pivotal point at any business where you realize that you're growing from a small business to, a medium-sized business or a bigger business. And it really got to the point to us when we started looking at the way that we could contract differently. So in pharmacy, traditionally, a pharmacy is contracted with a PBM or an insurance plan, and you get reimbursed for the medicine. It's like a fee for service. But what we realized with the level of care that we providing was that we were actually able to be paid on the value that we were providing for the patients, not necessarily just for dispensing their medications. So when we really started looking at pharmacy differently, and we started getting into, going individually to health plans or provider groups or ACOs and saying, hey, we want to go at risk here. We want to be able to, to build a value-based contract, not just get paid for the medication that we're dispensing, but get paid for the outcomes we're producing. That's when we really started to look at the business differently, and we said, okay, this is a real avenue in pharmacy that can work. And how can we best support the industry with that? And that's kind of how we grew into the different types of businesses that we have.
hmm It made me think of value driven as well too. What exactly is the difference with the value driven? You'll compare this like to paid by the medication. Like say you get oh, I'm trying to think of one like a thing of penicillin getting from like a big name pharmacy compared to like a penicillin from another pharmaceutical or a penicillin is just simply generic.
Right. So you may go to a typical pharmacy and say you get that penicillin. That pharmacy actually gets paid for providing you that penicillin. So they bill out the 20 penicillin tablets that they provided you, and they get paid for those specific tablets or capsules that they gave to that patient. Where our contracts differentiate is we'll get paid for the actual outcome of what that penicillin does. So we're able to get paid for dispensing the drug. We need to be able to be paid for the product that we're providing, but we will have differentiated contracts, or we may go at risk to say, okay, we gave this patient penicillin. This penicillin was supposed to keep them out of the hospital or take away this infection. And if it doesn't, we'll go at risk and say that we shouldn't be paid as much for that because it didn't solve the problem.
Okay, that's what I was trying to get at with the outcome. It's that how effective was that penicillin? And of course,
Yep.
of course, that's a number one thing. Of course, we can go into other drugs, but the penicillin is number one. Is there like different types of penicillin, the quality of penicillin, or how much quantity they put in penicillin. Does that factor into anything like that?
Well, every medication has different types of milligrams, and there's multiple manufacturers of generic drugs, and they come from all over the world. When it comes to the quality, I mean, the U.S. has phenomenal quality standards. I very, very much doubt. I have not seen a report in recent years that ever states that, the quality of a drug has been compromised because of where it's coming from or what manufacturer it may be made in. Um, but all these different manufacturers, when they're creating the generic drugs, they use different types of fillers and binders with the actual medication in it. And so each little drug from different manufacturers may be a little bit different. And there are times where you have patients who may not be able to take one manufacturer because of a certain filler or sugar or something that's in that
Mm.
specific drug. But for the most part, the main molecules and the main ingredients are is that high quality medication, and you can trust if you're getting something from an American pharmacy that it is going to be high quality and up to the proper
Mhm.
standards.
And you talked about fillers, being in penicillin, certain drugs and everything. How much filler do you put in, and how much percentage is that, let's say, the actual pure penicillin? What percentage would
It
you say?
truly depends on the molecule of the drug. So, all of these different drugs have different types of compositions that they're supposed to have, and different equations that go into creating the drug and the capsule, the size of the capsule, if it's a capsule or if it's a tablet. Is it a delayed release? Is it an immediate release? There's so many different factors that go into it, but the most important thing is that if you get a medication and it says 20 milligrams, you're getting 20 milligrams of that specific medication molecule that you're supposed to be getting. There may be other milligrams of binders and fillers and things to create the capsule, but the most
Mm.
important thing is that you're getting that 20 milligram of drugs.
Uh-huh. And I think that's really important as well, too. And of course, more in the healthcare industry, especially with the recent victory of Donald Trump. And how's that going to affect healthcare? We'll find out with the president of Centennial Pharmacy Services, Lindsay Dymowski Constantino. But first, listen to the Mike Wagner Show at the MikeWagnerShow.com, powered by SonicWeb Studios. Visit online at SonicWebStudios.com for all your needs. Look at a professional website, how you not breaking a budget. Sonic Web Studios is the answer. Sonic Web Studios offers fast, affordable custom web designs that blow the competition away. Call today 1-800-303-3960. That's 1-800-303-3960, or email to support@sonicwebstudios.com. Mention Mike Wagner Show. Get 20% off your first project. Sonic Web Studios. Take your image to the next level. Also, time to give official shout out to our official sponsor of the Mike Wagner Show, international warring author Mia Molson-Zia. If you love fast-paced mysteries, you love Missing by Mia Molson-Zia, available on Amazon and paperback and ebook. Missing is fast-paced and intriguing with an unforgettable twist. It takes place in 4 countries, 2 strangers, one target, where truth is illusion and those who love me to first go missing. It's available on Amazon and paperback and ebook. Missing by Mia Molson-Zia has garnered great reviews and even loved and enjoyed by Howard celebrities, including Jonah Cassidy, Forrest Riley, and many others. So grab your copy today before it goes missing by Mia Molson-Zia, available on Amazon. Also, the Mike Wagner Show is brought to you by Sweet Psalmist by Serena Wagner, based on the life of David, including 30 exquisite paintings and King David Psalms. The Sweet Psalmist gives a new perspective of David through the Psalms he wrote, his time as a shepherd growing up, and complicated yet turbulent relationship with King Saul. It's a story of love, hope, repentance, betrayal, and more. Check it out, The Sweet Psalmist by Serena Wagner on Amazon. Keyword Sweet Psalmist Serena Wagner. Also, check out the Mike Wagner Show at the MikeWagnerShow.com. 40 podcast platforms, 100 countries. Take us with you on any mobile device. Be sure to subscribe to us on Facebook, SoundCloud, Spreaker, Spotify, iHeartRadio, YouTube, BitChute, Rumble, and more. For great gift ideas, go to Amazon.com. Check out the Mike Wagner Show podcast, t-shirts, pop sockets, throw pillows, tote bags, hoodies. Makes great gifts 24/7. Go to Amazon.com. Check out the Mike Wagner Show podcast. And for more great gift ideas, go to Amazon.com/Mia Molson-Zia for great books, merchandise, and more. And be sure to support the Mike Wagner Show on Anchor FM, PayPal, and the MikeWagnerShow.com. We're here with the amazing president of Centennial Pharmacy Services and the co-founder principal of the Centennial Group Pharmacy Management Company, Lindsay Dymowski Constantino, here on the Mike Wagner Show. We cover about the basics of pharmacy, how it got started, and now the number one is about healthcare. You hear about the news, how it's going to affect Medicare, Medicaid, health insurance, and everything. With the recent win of President Trump, how is that going to affect healthcare as well too. So basically, just we'll throw it back to you, Lindsay.
That's a lot in one question.
Well,
Um,
if Donald Trump can stretch it out on a
yeah.
golf course, I mean, we can all do it, especially you can as well. If Trump can do it, so can you.
Yeah, yeah, you're right. You're right. So, you know, it's really interesting because this administration has, I think, a reputation, we can say, that they're really going to shake things up. And I don't think anybody is really upset about that. I mean, I think we can all agree as a country that things need to change, things need to be shaken up. We really need to we need to make some real change here in a lot of different industries, and healthcare is obviously one of them. I mean, there's
Right,
a
number
lot of
one.
yeah, there's a lot of heated conversation. I mean, we see that what just happened with the CEO and what's going on with all the different healthcare entities
Oh my
CEOs.
gosh, that was
So
sick, sick,
it,
sick, sick. I don't want to go down that
terrible.
rabbit hole. Oh my gosh.
No, but I mean, it just shows you the state of the thought process of this country when it comes to healthcare. It's devastating. So, first things first, the Trump administration historically likes to deregulate, which I think can be really good in healthcare because there are a lot of different processes that are important to have regulations for, but there's also a lot of things that is very redundant and repetitive, and things get held back in regards to patient care because of these kind of nuanced regulations that really don't make sense when it comes to truly taking care of a patient. So I'm looking forward to seeing what opportunities there are within Medicare, Medicaid, CMS to really kind of deregulate this and allow there to be the correct type of guidance and the correct type of regulations without it being like very nuanced or overwhelming for providers. I also think that there's been a lot of discussions recently within the current administration and in the incoming administration about PBMs, pharmacy benefit managers, and how much they impact the industry. I think that the whole pharmacy world has been a little shocked with how outspoken President Trump has been with talking against PBMs because his stance wasn't quite as confirmingly negative or positive as it has been in his previous administration. So this administration, he's really seeming to take a head-on stance with them and really try to figure out how to make sure that the pharmacy benefit managers are there and supporting the industry and how they need to support the industry instead of again putting all these different types of regulations and fees and really putting a lot of different pharmacies out of business by some of the ways that the contracts are developed. So I'm really curious to see how the PBM issues that are going on in the country will play out, especially with a president who has been so outspoken against them recently. Um, and overall, I think that there's going to be a lot of changes to HHS and CMS. And I think that a lot of it is going to kind of trickle down into how providers are going to be operating, how pharmacies are going to be operating, what vaccine schedules may look like, how we're able to best provide care, where a patient can receive different types of care. So there's a lot that's going to be changed, or that's supposed to be changed, I should say. And I'm really looking forward to it. I think that it's going to be a really good time for healthcare to be able to take a step back, say, we've gotten a lot of things wrong in the past 20 years. Let's try to reverse this and course correct so that we can make sure that one, we can properly support our aging population because everyone 65 and older is going to be, or I'm sorry, all the baby boomers are going to be 65 and older by 2030.
Correct.
And
Yeah, and I think the whole issue was with Medicare, Medicaid, and they're worried about
mhm,
the benefits being cut, and they're worried about
yeah,
lifespans being cut, hospitals not providing care. That is the number one right there, and everyone's concerned about, especially baby boomers. You're right.
yeah, exactly. And I mean, it's a real problem because you look at this and you go, This population is, first of all, massive. They have broken everything that they have entered, from housing to jobs to, they're going to end up breaking Social Security. They're going to end up breaking Medicare, and that's just because it's such a large population, and uh, they're also the sickest population of aging that we've ever had in this country. So we're really going into the Wild West. It's very unknown, and we there are pathways to be able to provide affordable, accessible care. And I think that we're going to have an administration who is going to come in and look for those solutions and not try to piece together things that are already happening to make them work. I think that they're going to look for new solutions and new areas to provide care, and new opportunities to expand scope of practices. And I think it's going to be a good thing for healthcare.
And do you think the regulation is going to be a type where back in the day with Reagan, he came in and deregulated air traffic controls, bust up the union. He also came in and broke up, AT&T, forced them into little baby bells. Do you think the Trump administration is going to break up all the major healthcare networks, the pharmacies and all that, like the really big conglomerates, and force them into little small ones to a point like back to small town pharmacies?
I wouldn't be surprised. I mean, like I said, the PBMs, the pharmacy benefit managers, are a hot topic now. And one of the reasons why it's such a hot topic is because the entities themselves are typically owned by insurance groups and retail pharmacies and long-term care pharmacies, and even like the wholesalers and the distributors and things like that get into the mix with these big conglomerates. So I have a feeling that we're probably going to see a lot of those entities needing to separate. And that's something that's been in the works for a very long time. But I do think that you have an administration coming in who really wants to see that happen and will really push it across the finish line.
And of course, another big topic as well, too. I hear from people all the time I talk to on camera, off camera, online, offline, in person, wherever I go. Health insurance. The cost is rising like crazy. Premiums, everything. I'm hearing about, $100 gets taken out of paycheck, two, three, four, five, and one family, $1,000. It's like, do you think the Trump administration is going to, take part in trying to lower those down to a point? I remember back in the day where it's like, employers actually paid for employers' health care. Do you think it's going to change anytime soon under the Trump administration?
I would really, really love to see that. I would love to really see things really shooken up in the insurance industry. Um, I think that fundamentally, the way that health insurance is applied in America, it's a very short cycle, right? These health insurance plans are typically only insuring a patient for a year, or they may be insuring them longer, but the patient's only signing up for a year. So these health insurance plans have these very, very short revenue cycles to attempt to make a profit on this patient, because at the end of the day, it's a business. And I think that having that short revenue cycle is fundamentally flawed for health insurance, because you can't look at a patient year over year and really truly take care of them from a business standpoint. Like if you are supporting a patient in their health, you need to be there for them for a lengthy period of time. So I think that the insurance sector needs to be changed to be able to have extended periods of coverage, especially for those who have chronic diseases or chronic illnesses, where they can get the proper care that they need, and the insurance company can be be encouraged, I guess, that they're going to continue to have this patient and potentially be able to make a profit on this patient, because they won't spend all this money on these, big chronic disease treatments and then lose the patient and never make up for that. And it's very, very frustrating to talk about, because it's disappointing to have to look at a patient as a dollar sign, but
Right.
that's what the health insurance companies do. And you have
Mhm.
to, when you look at this issue, you really have to look at it from their view, and it's just it's terrible.
I remember back in the day too, where pharmacists actually gave the patient the pills and everything, and their cure. Now it's just like they don't take care of the root problem. It's like pill after pill after pill after pill, and it's like then the problem never goes away. That's been a huge problem these days.
Well, exactly. And, surprisingly, a lot of that is due to medication non-adherence. So, what we typically see in pharmacy is that, say, someone has high blood pressure and they get put on a blood pressure medication, and it seems simple enough, right? Well, this patient, throughout the course of their 30-day med cycle, forgets to take their medication 15 times, say 15
Oh,
nights throughout the
uh-huh.
month, right? Well, they go back to the doctor to get a checkup, and their blood pressure is still high. And the doctor goes, hey, Mike, did you take all your medicine this month? And you go, yeah, I took my medicine every night. I don't know why my blood pressure is still high. And so the doctor goes, okay, well, we're going to have to add another medication for you because this one's not working. So then all of a sudden, this person's on two blood pressure medications. And it happens again. And now they're on three blood pressure medications. And now they're on so many blood pressure medications that they have to take another one to protect their kidneys to make sure that everything's okay while they're taking the medication. So it really starts to pile up where medication non-adherence is a significant issue in why people are taking so many medications. And it's a huge cost to the entire healthcare system. And
Hmm.
if we could really expand the pharmacist's scope of practice to be able to properly address medication non-adherence, to be reimbursed for it properly, and to be able to support the providers with providing solutions for it, it would save the insurance companies thousands and thousands of dollars on patients, and it would be better for the patient because the patient wouldn't be taking unnecessary medication or duplicate therapy when they don't really have to.
Hmm. And of course, what's also lacking these days is also the personalized treatment. And there's many technologies doing that and personalized treatment on a whole new level. Find more about that with Lindsay Dymowski Constantino of Centennial Pharmacy Services. You listen to the Mike Wagner Show at the MikeWagnerShow.com, powered by Sonic Web Studios. Brought to you by official sponsor of the Mike Wagner Show, international warming author me, Moses M. Missing. Also, Sweet Summits by Serena Wagner, based on the life of King David. Now on Amazon, keyword Sweet Summits Serena Wagner. We'll be back with the owner of Centennial Pharmacy Services, the president, Lindsay Dymowski Constantino, after this time. We're back with president of Centennial Pharmacy Services, Lindsay Dymowski Constantino, here on the Mike Wagner Show. We talked about healthcare. We talked about the state of it and the Trump administration making some changes. And of course, the one thing that's been missing is the personalized treatment. A long time ago, the pharmacists gave a personalized treatment. The doctors did. And all of a sudden, it seemed to have gone missing. It's you wonder, it's like, what happened?
Yeah, it's all pharmacies have really been pushed to their limits, and I think we've all seen the news headlines with some issues that have been out there. Um, I I just truly believe if you are going to a pharmacy and that pharmacist is not approaching you and saying, how are you doing on your medication? Is everything okay? Then you need to go to a different pharmacy because your pharmacist really should be checking in with you and making sure that everything is going well and that you have an opportunity to be able to ask them questions. Um, Personalized care is something that we focus on a lot in my business. And it's because when you actually start to engage with patients and you talk to them about what's going on, you can solve so many of the issues that come across with managing chronic diseases. Just finding out that a patient doesn't necessarily like taking medication in the morning, they rather take all their medication at night. That can make a huge difference to the outcomes of their health because you had a simple conversation with them.
Well, hell, I think we lost Lindsay here on the Mike Wagner Show. I think we got disconnected right here. So once again, the Mike Wagner Show is powered by Sonic Web Studios. Visit our line at sonicwebstudios.com for all your needs. And looks like we lost connection with Lindsay Dymowski of Constantino of Centennial Pharmacy Services here on the Mike Wagner Show. And we're trying to reconnect with Lindsay in just 1 minute. And looks like we're back on here. So
I'm sorry about that. I talk with my hands and I knocked over my
Ah,
laptop.
yeah, Italiano. You speak with your hands. That's right. Yeah, your godfather. You know what?
Oh, I'm so sorry.
That's okay. That's okay. At least a cat didn't walk in and walk over. I've seen some things like that too. And of course, getting back to the personalized care and everything. In fact, you even have the home doctors come by, knock on the door, carry the little briefcase, whatever it is, their black box, give them their pills,
Yeah.
and off on you go. And there's some reports I've been reading as well too. I've had people on my show and saying that the one frustrating thing is that you're only allowed 15 minutes to visit with a patient because insurance regulations. And I listen to that 15 minutes. It's literally not enough.
It's really not. It's really not a lot of time, and I think it's just as frustrating for the providers as it is for the patients because there's a lot that they want to do. And nobody goes to medical school to be dictated by an insurance company on how they should care for a patient. So being able to truly care for the patients is what everybody wants to do, but there are a lot of different types of regulations and guidelines for timing and billing. And I mean, it's confusing. There are whole teams at providers' offices that are just doing coding and billing because of how complicated it is. It's its own language, and I think that is definitely something. We just talked about changes that could be made with the new administration. That is definitely something that should be looked into, making sure that the providers can be providers and the doctors can be doctors, and they don't have to worry about the oversight of, timing or specific coding, or are they allowed to have this conversation before having this conversation. It's very frustrating. And a lot of the things I think were put in place for a good reason, but they just got out of control.
Mhm. And of course, another thing too, which is coming around, has been the news, is the use of AI, and it's becoming on the rise as well too, where AI is being used in healthcare as well. And the big question is, do you consider a revolution is going to make it better, or does it become like a big risk?
So I think that AI can be a useful tool, just like any of the other technologies that we've had that have now become secondhand tools used for providers. I do think that there are a lot of really unique AI solutions out there, like particularly when it comes, for looking at how medications interact with each other or how certain chronic diseases may interact with each other. Things that every doctor and every pharmacist has education on but doesn't necessarily see every day that can really support them being a better provider. Um, so I do think that it can be a useful tool. What I don't want to see is, there's a lot of opportunity here, I think, for um, work, potentially clinical work, to be offloaded to AI. And I don't think that that would be healthy for the industry. I think that we need to make sure that the providers are given tools so that they can make the correct clinical decisions. But at the end of the day, it really needs to be those providers who are making the clinical decisions. And we need to make sure that the technology is supporting us, not guiding us.
Mhm. There's also another concern too. Of course, you have the HIPAA statements, like with data privacy, right to access, and everything. And do you think AI is going to enforce the privacy, or you think that's going to be going rogue?
I don't know, right? It is a little scary when you think about it because it's artificial intelligence. Like, you can say, this is HIPAA protected. We can't share this information, but I mean, these computers can get very, very smart, and they are smart. I was just reading something about um, how one of the AI systems attempted to duplicate itself and then lied about making the attempt to duplicate itself.
Oh my
And
goodness.
yeah, when you think about the fact that this artificial intelligence can think like that, you do worry about, are they going to respect what I'm requesting of them? If I say, don't share this information, are they going to respect that request? You just don't know.
Mhm. And there was a thing too I was reading about. We talked about the CEO of United Healthcare that got murdered. That's obviously been in the news. I'm not going to go down a rabbit hole, but there was also a thing too with United Healthcare where 9% of the claims have been rejected thanks to AI as well, and the chat. And of course, that could also go wrong too. Like, AI can go rogue in a way. It's like, you may have an obvious claim, but gets rejected.
Right. I mean, there could be a system put in place where this AI's goal is to live within these parameters to be able to protect this type of revenue for the insurance company, right? Well, they're not looking at the patient holistically then. They're looking at that specific item and making sure that they're hitting these metrics. So, um, I mean, there is really a lot of opportunity for AI to not support the patient's health in the way that we need it to support the patient's health.
And of course, last thing as well too that just the same thing about the future of healthcare. Now, if you were to run healthcare, what changes would you make?
If I was running healthcare and I had the opportunity to truly make a change, I would find a way for pharmacist scope of practice to be expanded so that their accessibility and their knowledge can be truly used in the industry in the way that it can be, while supporting providers. And I would really love to see the entire system go value based. I am a huge fan of value based healthcare. I think that it's a real way that providers can make sure that they're making an impact, that they can ensure the quality of care. And I think as a provider, you feel better about yourself when you're not just getting paid for, seeing someone for 15 minutes. You're getting paid because you made that patient feel better. I would really love to see the system move to value-based care.
In the meantime, where can we find out more about Centennial Pharmacy Services? Where can we find more about the Centennial Group and how they get a hold of you and how can they get more information?
Yeah, well, you can visit Centennial at centennialpharmacy.com, and you can visit my LinkedIn profile. I'm very active on LinkedIn. I'm always on there. It's Lindsay Dymowski Constantino, and I look forward to being able to chat with everybody.
That sounds great. We'll certainly do that. We're here with the president of Centennial Pharmacy Services, Lindsay Dymowski Constantino, here on the Mike Wedner Show. Just a few more things. What else can we expect in 2025 and beyond?
Oh my goodness. I I think that the first half of 2025, we're kind of going into this unknown, especially with the new administration. I think that there's going to be a lot of things um, that are going to be changed in for good. I also think that we're going to see a lot of opportunity, particularly for healthcare, come back to the states. I think when it comes to manufacturing and different types of like medical devices and different types of even like procedures and things like that have a lot of success behind them that have been held up. I think that we're going to see a lot of things get pushed through that is going to be really good for patient care. And beyond 2025, I just really hope that we can, as a country, solve this insurance issue that is all on top of minds. I think that there are different pathways to do it. I don't think you're ever going to get rid of private insurance. I think that's here to stay in America, but I do think that there are ways to be able to better support the patient while making sure that the private companies are, or public companies rather, are hitting the goals that they need to hit. So
Mm-hmm.
I'm looking forward to see how that changes.
In the meantime, just take 2 aspirin and call you in the morning. That's the best solution. So,
Exactly.
and just a couple more things. Who do you consider biggest influence in your career?
Oh my gosh, my parents, absolutely my parents. My dad was instrumental in having me become passionate about pharmacy and passionate about business. And my mom was instrumental in making sure that I always brought it back to the patient and worried about what was happening with that patient and how is every single thing that I'm doing affecting that patient. They're my heroes. I love them.
That's so amazing within family as well. What's the best advice you can give to anybody at this point?
Oh my gosh. Best advice is just look at the world with, glass half full. There's a lot of great things going on, and I think we all doom scroll and we see terrible things on the news, but really don't take anything for granted. I think that there's a lot that this life has to offer, and you know, try to look at things and be optimistic about everything because it's not probably not as bad as we think it is.
And that's a really good point as well. I like what you said. We're here at the multi-talented Lindsay Dymowski Constantino of Centennial Pharmacy Services here on the Mike Wagner Show. Lindsay, a very big thank you for your time. You've been absolutely fantastic. Learned a lot. Looking forward to having you soon. Keep us up to date. Keep in touch. Love to have you back. Once again, what's your website? How do people contact you? And where can people simply get information about what you do?
Yeah, centennialpharmacy.com if you're interested in medication management services. And you can find me on LinkedIn, Lindsay Dymowski Constantino.
We'll certainly check that out. Once again, Lindsay, a very big thank you for your time. You've been absolutely amazing. Looking forward to having you soon. Keep us up to date. Keep in touch. We'd love to have you back. We wish you all best. And Lindsay, you definitely have a great future ahead of you.
Thank you, Mike. I appreciate it.